Hi, I'm Dr. Shin in the Department of Neurology at Mayo Clinic, Rochester, Minnesota. I'd like to talk to you about women's issues with epilepsy. Now, another issue that women face perhaps more than men, especially in the post-menopausal time, is osteoporosis. However, the osteoporosis is not necessarily just a condition of the older age women. Medications for epileptic condition frequently speed up the metabolism in the liver of various hormones and vitamins. And vitamin D is one of them. So that vitamin D is metabolized quicker in patients who are on medication that speeds up the liver metabolism. Now, not all seizure medications do that, and some of them are particularly more prone to do it. So those details you'll have to really discuss with your neurologist. But if they are speeded up in terms of his liver's processing, then the patients can become vitamin D deficient for a long time. And couple that with a general deficiency of vitamin D, since people nowadays avoid sunshine and put on the sunblock, I think many people are becoming vitamin D deficient, and especially if you're on seizure medications. So the remedy for that is to get more sun, obviously, but also to get vitamin D supplementation. Vitamin D level can be measured in the blood, and you could supplement depending on the severity of your need. And many multivitamins will have 500 or 600 international units of vitamin D, and for some that may be sufficient, but for others you may need more. And there are a lot of over-the-counter preparations that contains both calcium and vitamin D, and you could take those. Vitamin D can be taken in fairly substantial doses, in 1,000, 2,000 international units per day without concern for major problems. Now, if you're taking calcium, there are some medications that calcium will interact, so you do have to be careful. The specific one is phenytoin or Dilantin, brand name, and that can interact with calcium, and that can reduce the medication absorption. So you have to space that out from the medication intake when you take the calcium. Of course, there are a lot of calcium supplemented foods like milk and orange juice, and that's good that you take them, but in your case, you may need actually additional supplementation, especially if you are taking seizure medications.